We will start in a minute. I am so excited at what we will start. So welcome everyone. Welcome to Medical Mondays with Dr. O. Another exciting Monday, and happy Thanksgiving in arrears. I hope everybody had a great Thanksgiving. I hope you ate plenty of turkey. Like I did, I'm still eating turkey. So, Dr. Toyin Okwesomi, I'm a family practitioner. I treat HIV and addictions in Baltimore, across Maryland, actually. And I just enjoy Medical Mondays with Dr. O because I learned so much on this forum. Tonight, we are tackling a subject that we have never tackled. We have had an election and we got results, which has led to a lot of anxiety in some people, even depression. My phone has been busting. People are worried about one thing or the other. They're worried about what will be or could be, and a lot of things on social media that are not always necessarily true. So it's become a health issue, mental health issue that warrants for us to confront it head on and address it. And we have been blessed by two amazing pillars in our community that have decided to, step up and just assist us in dialogue and walking through some things in this arena. We have tonight Dr. Fabiyi. These people are my brother and sister. Dr. Malcolm Fabiyi and Dr. Nkem Okeke. I'm going to have both of them introduce themselves fully. They are pillars, they are giants in our community in different ways. And I've had the privilege to work personally with each of them, to interact personally on different levels. And so I'm going to yield the floor to Dr. Fabiyi to introduce himself, and then Dr. Okeke to introduce herself. And then we'll take it from there.
Thank you, Dr. O. It's a pleasure to be here with everybody. My name is Malcolm Fabiyi. I am not a medical doctor. My background is in chemical engineering, and I run a company that's focused on mostly environmental engineering. But I also wear two additional hats. The first is I run an organization that's called Governance Advancement Initiative for Nigeria. That's focused around, trying to find ways of pushing our politics back in Nigeria to one that is perhaps more responsive to the needs of the people, and also trying to enhance civic engagement by Nigerian Americans here in the US. And then the other one is that I serve on the board along with Dr. O of the Nigerian Center, an organization that's very young but is doing remarkable things, in terms of providing support to our community, especially in areas around immigration. So happy to be here. Looking forward to the conversation.
Thank you so much and welcome. Dr. Okeke.
Yeah, good evening. My name is Dr. Nkem Okeke. I'm a physician entrepreneur, and my primary business is focused on value-based care through my for-profit and non-profit medical links and health links. I support health insurance companies, provider systems, as well as government payers like CMS to not only craft policy, but also to implement those policies through different programs and initiatives. And one newer venture I co-founded. It's called BIND. It stands for Business Integrated Network in the Diaspora. And that's a collective of business owners that are of native African origin that are focused on US-Africa trade. So the goal is to make sure that as the world sees Africa as an emerging market, that we are part of that conversation, not just by talk, but by deed, and how we can collectively work together and as well as expand our businesses into Africa as well. I'm happy to be here.
Fantastic. Welcome. Welcome, both of you. So without much ado, I'm going to once again yield the floor to Dr. Malcolm Fabiyi. Please take it and roll with it. What are we experiencing? What should we experience? What are we going through? What's going on?
So, so it's an interesting topic, and I think it's also an unprecedented topic. So it's going to be I think discussing the impacts of politics on anxiety and health and stress and all those issues is always interesting. But we're Nigerians. We're fundamentally Nigerians. So I think if there's any community that understands what it means to tussle with stress that is politically related, I think we have A pluses already, all of us, in those types of issues because of where we come from. As I was reflecting on this topic, what struck me was that there are probably three different ways in which anxiety and stress might be induced by, kind of how we receive political outcomes, especially the one that happened just a little over a week ago with the presidential elections and other elections that took place here in the US. Those three areas one would be around relationships. We just had Thanksgiving, and it was interesting going through the press, listening to the news, and finding out that there were some families where some people were uninvited from Thanksgiving, where there were significant issues that came up related to who supported who in the last election. My guess, though, is that that's not a problem that many Nigerian families have. All of us belong to WhatsApp groups. All of us belong to different groups. And on the groups that I belong to, there was a lot of variety of opinions. And there was support for folks across the two broad swaths of the political spectrum. We had our fights, we had our debates, and everybody is back to jollying up with each other. So again, fundamentally, my view is that as Nigerian immigrants and Nigerian Americans, we're not unfamiliar with political conflict, but we don't necessarily let that lead to a place where relationships get broken. The other area of anxiety, I think, would be economic anxiety. So what happens? Tariffs are coming, maybe tariffs are coming. What would the implications of that be for things like inflation? My guess, again, is that for most of us, for most Nigerians, whatever happens, whether it's positive, negative, whether the economy improves, whether the economy is challenged, whether inflation goes down, whether inflation goes up, inflation stays constant. My guess is that economic anxieties are not a major thing that assails us. Whatever happens, we will be fine. We did not travel 6, 7, 8,000 miles to we've faced worse things and we've faced more difficult challenges. So a lot of the people that I talk to, that's not a big area of anxiety for them, economic anxiety. There are many people for whom the election turned on a lot of economic issues, like all other folks living in America. We also have economic challenges, but I think that it's not a major source of anxiety for us. The third one is immigration status. And I think that's where the significant anxiety is from. Because the reality is that there are many of us, many people in our community that are still dealing with immigration-related issues. Some are still in the shadows. Some are trying to regularize their tax status. Some are here supported by programs like TPS that allows a temporary protected status. Some folks are here because, they have anchor children that are the basis by which they are hoping that their status will be regularized. Some folks are here on visas that might expire soon. So immigration-based anxiety is real. And immigration-based anxiety is something that impacts, without a question, our community. Dr. O, you know that at the Nigerian Center, there are many things that the center offers, but the most significant one that people engage the center on are immigration-related issues. So it's a big issue. But my sense is, so as I looked back, the good news is we have a new president-elect who is actually not new to us because he was here just about 4 years ago. And as I was reflecting on the things that, we might perhaps expect under immigration, the big concern that folks have is how quickly will things change? Is there going to be, will there be mass deportations that will happen on day one? Are lots of people going to be rounded up? The fact is, just for us to remind ourselves, that there were perhaps 7 major immigration policy initiatives in the first term of the president-elect who's coming in. There were major initiatives, but the reality was that there's what you hope to do or what you promise to do or what you want to do. And then there's the reality that there are many systems in place in this country that can have an impact on how quickly those things get done. So just as a reminder, there was a travel ban, a Muslim ban that was initiated probably on the very first day that the current president-elect became president last time. There was a family separation policy that basically took people coming that were apprehended at the border and separated families. And it was a policy that the government was trying to push as a way of discouraging, the flood of folks seeking asylum and coming across the border. There was the executive order on DACA that was intended to reverse the DACA protections that mostly young folks had. There was the another executive order that targeted the temporary protected status (TPS) that allows many people who come in to request for protections that allow them to actually, to have some immigration coverage while they're trying to regularize their stay. There was the change to the public charge rule that was intended to enable the government remove people on the basis that there was a likelihood, from some would argue arbitrary determinations that would establish them as potentially coming in and having no way of supporting themselves, and therefore they were going to be charges of the state. There were the asylum restrictions that were introduced, and then there was the census citizenship question, where the intent was to actually put a citizenship question in the census, and that would enable the government also have a greater insight into who was legal, who was illegal. 7 major areas. Every single one of those things did not move forward as intended. Why? For the travel ban, the state of Hawaii and the ACLU immediately went to court. The lower courts stepped in, they suspended those policies, and it was not until 2 years later, in 2018, when the Supreme Court actually came in and allowed certain portions of that to go through. Family separation policy, the ACLU immediately filed a court case. There were several advocacy groups that joined them in those cases, and the courts basically reversed a significant number of those policies and ordered the reunification of separated families. The DACA one, that was challenged by the regents of the University of California and the NAACP. The TPS one, which is again significant because it affects a lot of folks in our community. There were many immigration advocacy groups that immediately took those orders to court, and the courts immediately issued injunctions that prevented termination of TPS for certain countries. The public charge rule was also contested in court. Asylum restrictions, again, the ACLU, the Southern Poverty Law Center, the census citizenship question, the state of New York filed against that, the ACLU, and many other groups. So the short, in my view, yes, there will be this election partly turned on the issue of immigration. It's an important issue. There will, without a doubt, be immigration reform. But if history is anything to go by, my sense is that there will be things will change and things will happen, but the speed with which we probably think or are worried that they might happen, the arbitrariness that some folks might be worried about, my guess is it is very unlikely that that will happen because every single tool available to both supporters and those who are opposed to these policies will be utilized. And the courts would actually, again, have a significant role to play in kind of moderating these immigration policies as they did 4 years ago when we were in a similar situation. That was 4 years ago. So if I, very briefly in the next minute or two, I'll talk about my sense of the concerns this time around. So we've seen what came before, but there was, so again, some conversations that were a little different this time in terms of what immigration might look like. So one, again, is the fear of mass deportations. I think a lot of what we saw last time will have a significant impact on, how quickly these deportations might potentially take place. Revocation of immigration benefits. So again, things like TPS, DACA, those would likely be impacted. That's not new. That happened before. And we know that the courts were able to slow things down, did not stop it completely, but the courts were able to slow things down. So my expectation is that there would be similar lawsuits and similar organizations and advocacy groups that will be engaged in trying to work out ways in which those policies will be as humane as possible. Denaturalization is something I think a lot of people are worried about. So there's been talk about, yeah, you might think you're a citizen, but you're a naturalized citizen. And if we naturalize you, then we can denaturalize you. So there would likely be, again, that's causing some anxiety, especially for those who might have folks within their family networks that are all still not regularized. But again, my expectation is that there would be a lot of legal issues coming up around that will slow things down and perhaps not make them move as quickly as some of us might be afraid of. Then one that's very relevant to the conversations we're having is access to healthcare and social services. There are a number of people that, that I've spoken to, and, as you read the fallout and the concerns people have is, what if I want to access healthcare and social services? Will I be giving myself away? Will I be exposing myself? Will I be putting a target on myself because I have to disclose certain things? And I think in those lights, there was something I was discussing with Dr. O yesterday about what happened in Texas. So November 1, Texas rolled out a new requirement that anybody going to access hospital healthcare services would be required to provide their citizenship status. And it caused a lot of controversy, but a doctor came out from one of the healthcare systems there and indicated that they'd been informed by their legal support within the hospital system that patients were not obligated to provide responses. So they could ask the question, but patients were not obligated to provide them with that type of answer. And the state was quite understandably upset. In fact, they were threatening to withdraw some funding for that particular hospital system. But I think those types of things are what we can expect. That the regulations will be rolled out, the rules will be rolled out, but a combination of advocacy groups, again, the Nigerian Center, I think, being one of those, and perhaps NALA, the National Association of Nigerian Association of Lawyers, I think is that what NALA is?
Nigerian American Lawyers Association.
Lawyers Association, yeah. So my expectation would be that groups like the Nigerian Center for Sure, which Dr. O and I have some relationships with, NALA, and perhaps other advocacy
AMPA,
groups will
AMPA,
be able to,
AMPA.
NAPA for
No,
short, AMPA,
AMPA,
yeah.
the Association of Nigerian Physicians in the Americas.
So I think one of the things that I think would be helpful would be for those types of groups, the advocacy groups, the professional associations that have particular insight into these areas. I think it would be wonderful if we could develop some sort of framework and guidepost for folks who might have these concerns about, where they are from their immigration in terms of immigration status, how they can access social and healthcare services, and those types of issues. And then the final one is birthright citizenship. Um, I've had some interesting conversations about people trying to very quickly induce labor so that they can have their children before January 21st, because they are worried that birthright citizenship might be no more. Well, I would not be surprised if there might be an executive order in that regard. But the reality is birthright citizenship is a constitutional protection. The 14th Amendment protects it, and it's not easy to change that. So in order to change something that's in the Constitution, you need 2/3 majority to vote, not only in the House, but also in the Senate. In the current environment, I think that's an impossibility. And then the other thing is you also need 3/4 of the 50 states to actually support by majority vote the state legislatures that type of constitutional amendment. So I think birthright citizenship would likely survive. It doesn't mean there may not be maybe executive orders that target it, but my guess is that as soon as that happens, there would likely be some pushback legally and constitutionally to those issues. So those at a high level are some of the things that I've thought about and engaged with other people about and discussed regarding the anxieties that some folks are feeling about where we are and what might happen over the next few months as we enter into the new dispensation. Thank you.
Thank you so much. I like that. The new dispensation. Whew. Thank you so much for being real, for pointing out these major areas of concern. You've actually touched all the areas that I've been getting calls for. Thank you. Appreciate you. Dr. Nkem Okeke, the floor is yours. Kindly enlighten us. If you have questions, raise your hands or put it in the chat box, please.
Let me pause to see if anyone has a question now or want to wait.
Oh, no, go ahead.
Okay.
Questions are after.
Well, thank you, Dr. Fabiyi, for that insightful perspective. I think I want to start with saying we need to pray, as always. As a person of faith, if my faith is strong, I can weather any storm. As a person who is Nigerian, I can also, by experience, weather any storm. If you've gone through at least 3 different strikes and still finished college, as so much of government leadership disruption and the impact that we've seen, as young people, as adults, and that's true. But I'll say, yeah, this is a time to really stay very, very faithful, whatever faith you practice, because there's a lot of uncertainty in terms of the people that Trump is appointing to his cabinet. So we kind of know or expect X, Y, and Z from Trump, but there are people who he's appointing who we still, there are unknowns. We've seen them before and things, or learn more about their style of leadership, and they'll be advising him, right? So those are things that we have to keep in mind. But transitioning from the spiritual realm into making that practical and a reality, the difference this time is that the 3 branches of government is now pretty much influenced by Trump, if we put it that way. And that can make him accelerate things he would want to do otherwise. And that's something I think that is probably making the anxiety and concern heightened, right? So who's going to stop him? If he says, I want to do X, he could facilitate that faster this time than he would have in his last regime. So I think there is fair to be concerned. Now, talking about the different aspects that I think has been impacted in the past Trump regime, there were some positives that came out of his governance. One of it was that the US became a net exporter of oil and gas, and that wasn't something that happened before. Out of that came some economic boom, and some people benefited from that. I think why I'm drawing that connection or that dot is that when things like this happen, we begin to look for what opportunities we should start paying attention to. If you're a business person, if you're somebody going into a professional career, you start thinking about, where are the places I need to begin to turn to either diversify. COVID did that to a lot of us, and we have to pivot. So what pivot needs to happen from a personal standpoint as a business owner or as a professional when you're seeing where the economy might be headed and what influences or what drivers will influence the economy. So that's one thing that I'm sure he would, hunker down more on. Local manufacturing, he has threatened to do more of that. So that will also include his close relationship with Elon Musk would also support tech-driven solutions. So things one can think about. It will also foster business acquisitions, mergers, which they had tried to slow down in the Biden regime. Now, that I think that particular seat will no longer be there. The actual lady who was overseeing that role is my friend's daughter, Ms. Khan. And, now they're going to abolish that. She did try her best to stop a lot of acquisitions and mergers, which indirectly killed a lot of small businesses, depending on the industry. Those things were happening. So now with that, coming up, then one can start thinking again, if you're from a business perspective, how to position yourself to be acquired or to merge and sort of lean into what could be. And if you're a professional, pay attention to what your company is doing so you know the right time to shift or stay or advance, because all of that comes with its different perks, if I would say. The other piece also is thinking about immigration, as a lot of people have had the concerns for, and Dr. Fabiyi did highlight. And I think the truth of the fact is, depending on where you stand, the fear is real. If I don't have my papers together, the fear is real. If I think I'll be found out, I already have kids here who are citizens, the fear is real. And what I'll say to you is this, while we may not know if and when deportation may be enforced or happen, being aware that it may come may help you think ahead. I want to say it's a temporary closure, which you can address as if you were preparing for one's death. And I say that in parentheses, but I'll say the word closure. If I knew I had to leave this country and never come back, what would I do? So things I would think about is, what do I own? How can I secure that ownership? Can I get a trust? The affordable trust you can set up. You don't need a lawyer, you pay a lot of money. How can I set that up? What are the terms to set that up if I'm a citizen versus if I'm not a citizen? If I have a social security number versus I don't? How can I work with close friends, family members, all my children, niece, nephews, to make sure at least whatever it is I have is protected until. And then another thing also to consider is, what do you think you can do to fast track things? If you're already on your way to get your documentation to be legally here, what can you do to facilitate it? How can we, as Dr. O had mentioned, engage the NALA group and other lawyer professional associations who are probably thinking about this, and say, what are the things you're seeing, people approaching you, concerns you're having, and what ways can we start advising them legally to begin to put their quote unquote their affairs in order the best way possible. There's no good way to tell bad news. So if it must be told, how best can it be told so that it's well received and well acted upon thereafter? So that's another aspect to consider. The topic of healthcare is dear and near to my heart. Obamacare has done so much in the past 10, 15 years. Pretty much is why I'm in the line of work I do right now. And I'm happy that during the debate, even Trump could not tell you that he was going to repeal and replace right away because they don't have a plan. So I feel that would take time for them to think through the benefits of Obamacare and those who would lose insurance versus those who will be underinsured due to pre-existing conditions and so on and so forth. So I think there will be some thoughtfulness that will go into it because his supporters are also going to be impacted by this. So it's not about him making rules to make one part of the country happy and the other part who didn't support him sad kind of thing. It's not that black and white. So hopefully in that complexity of the solution, we get some resolve and things will probably happen in a more anticipatory way than in a knee-jerk way, so we can see things coming. The one that bothers me the most amongst all is the equity or the perception of equity. And depending on who is defining that and who is actually implementing that. The whole term DEI came up for a reason. We can't deny the fact that I didn't get called for a lot of interviews when I was up and coming because my name looked foreign. I couldn't deny the fact that as I was rising through the corporate ladder, there were times I had to repeat myself because somehow I wasn't sounding American enough. And how that erodes your confidence when you have to repeat yourself over and over again. My daughter is a freshman in college. We all here probably have kids, niece, nephew at different stages in their professional careers. I think that's what I worry for the most. What about my kids? What are they going to see with the ugliness? I would tell you the week after this happened, my daughter went to school, my middle daughter went to high school, and there was a text going around calling the black kids slaves, the black kids in the school slaves. And they have to get ready to go back to the plantation. And the school had to jump in. This in Montgomery County, and it was a county-wide information that went out to allay the fact. I think I sent Dr. O a copy of that screenshot of that sad text. So it's real. And unfortunately, we have our kids where we have to sit down and explain to them what this means, this emboldenedness. Somebody actually wrote slave on somebody else's desk, and this isn't a paid private school, bullies. So things happen. There are real impacts, and I think that for me is my bigger worry is what is the perception that equity means that gives spaces to people who look like us or are us. And now what changes when we feel that representation will be threatened for those who are in the workplace, promotion, for those who are businesses, more contract or business, depending on where you look at it. So for that, I think Dr. Fabiyi has mentioned how coming together would make sense for advocacy groups and things. I believe that. Currently, through the work we do with BIND, I didn't know this would be a big issue at the time BIND was formed, but that's part of what we also do. We have programs to advocate, but focus mainly on US-Africa trade and how that helps small businesses here that are owned by those of African origin. We have BIND Women to keep remembering that while we're thinking of this whole equity thread, that women are still, Black women are still at risk in many levels, as well as our Black men. And then we have another program called Bind Next, where it stands for the next generation. How can we start engaging our young ones, those especially in college to really see better ways to use business and trade to engage and address diversity. Money talks, we know. So as hard as it is, the more successful you are, people just want to identify with success. So how can we position ourselves to come together and just promote that, especially in our young ones and with amongst ourselves? So we focus on what we can control. That lessens my anxiety. So that will lessen more people's anxiety when you can focus on what you can control and do what you can. And of course, as always, keep the faith and pray to God. He knows all, he sees all, and he'll help you do the rest. So I would pause right there and have more dialogue during the Q&A session.
Thank you. Thank you so much. The personal aspect hit me the most too. Yeah. But again, we don't need to be anxious. Dr. Fabiyi, as you know, plainly stated, or if I can say it in a plain, more in a simpler way, if I'm correct, Dr. Fabiyi, correct me, is that we're still in a lawful country where things just don't happen. You just don't jump and do things. Things take a process. And we will all navigate that process together. So I'm yielding to everyone. If you have any questions, you want to raise your hand to ask it or put it in the chat box. While people are still thinking, you know, this is interesting. I think people are actually scared to even talk. But it's okay. I have a question, and either of you can answer it. In preparation, and I don't know really exactly what we're preparing for. Dr. Okeke, you had mentioned that, you know, one should maybe think of trust to protect assets, protect what one has. Can you elaborate a little bit more on that, apart from trust?
Yeah, so having one's trust is pretty much being able to secure what you own in such a way that is independent of you. Most people will do it just to protect them in times of demise. Most people who are business owners will do that to protect from being sued if you own a business. That's more popular. But in times like this, like as I said, if you anticipate a threat of a closure of any sort, that's also something to also consider. Again, cost of legal fees are always expensive, but there are also cheaper alternatives. And definitely would have our friends at NALA as a key resource to share the options that they are. And probably have another forum, Dr. O, to just talk about securing what one has, no matter how small. And the good thing about it is, don't think what you have is too small or nothing. You never know. But at least it takes off the anxiety when you have a plan and you're executing your plan. So those are things that I would say to consider. Now, for some who don't have anything to hold in trust, which is why I went to the other topics, is okay, so what do you think you can control now? And then brace yourself for what may or may not be. And then once you do that, the anxiety sort of goes away. Not that everybody has some borderline anxiety depending on the situation you are and the season you're in. But if you have a plan to address the concern, the anxiety kind of leaves you because you're busy anyway, focused on what you need to. And then again, I keep up reading the spiritual parts, which I think is huge and important. That if you pray, you have to let go and let God. So always remember that. But you also feel better when you're able to have a plan to advance things within what you can control.
Thank you. Thank you so much. Dr. Adiola Pokwola, kindly unmute.
Yeah, thank you very much.
Can you show your face, or you don't want to show your face to us? You don't have to.
I have a face. Thank you so very much. Now, this is the time to start thinking about showing your face or not. Thank you so much, our two very, very eloquent and erudite speakers. Doctor is very confident. She's so bold. We are not that bold. We are afraid, certainly. Number one, I put in the chat box already two of those questions, but let me paraphrase it a little together in 1 minute. I lived for about 2 years in a city called Lakewood, which I called a city of 1,000 Jews. And I know that any offense a Jewish person commits, he doesn't have to, if they pull him up or anything, he's so confident because there's a reference base. He can make one or two calls and a rabbi will represent him in court. The rabbi will show up and talk to the police. Okay? I'm trying to see how we can be like that. This is what we should have been doing before. Now the circumstances is now calling for that. So we should be a step ahead and have such an organization. If Nigerian has an issue about something or the other, there is some group, there is an address, there is a person you can call in the community who will step up and step in to at least give the idea. Don't leave us alone against the law or against persons that can take the laws into their hands. That is the fear we have. Most of us are regularized, but you can still, the link mentality can come out of these groups that are too excited about what is happening. I don't think the next will be so bad, but individuals can take things into their own hands. If you understand my drift. So I put in the chat box that can we form organizations? Can we ask operational organizations and social groups to bring that together, do in-service for them and all the other things, so that we can have the password among ourselves. If a policeman stops you for this, please just call this number. Okay? And the person is the social advocate in that area will step in for you or will step in with you. Okay? So they are not alone. We need that kind of strength as of now. I yield, please.
Thank you so much. Responses, please, Dr. Fabiyi, Dr. Okeke.
So,
Sorry, go ahead, Dr. Okeke.
No, go ahead.
So, Dr. Popola,
Okay.
I think I like what you said. And one thing I would say, and definitely quickly hand off to Dr. Fabiyi, is we have, what you say is an excellent idea. The question is, where does the authority lie? There's a hierarchy in power and authority when you're dealing with a quote unquote sovereign land. And right now, the embassy of Nigeria is supposed to represent Nigeria in the US. The Nigerian Center and that Dr. Fabiyi and Dr. O are part of can try to begin to broker this kind of, would I say, support that's needed whenever there is quote unquote a crisis, but it has to take a lot of awareness building and partnership with law enforcement across the country so that they know there's this such place called the center, there have to be branches, and so on and so forth, so that they know that, this particular group of people who have been affiliated with this country and so forth declare can get this support should they get into such and such an issue and they mention that, hey, I'm affiliated with. But again, that's a grassroots effort that has to start from somewhere. I don't know that we have that kind of progress now, but definitely a good place to start. But I think it's also something to do in partnership with the Nigerian representative here in the US that the US will be engaging and liaising with. Dr. Fabi.
Thank you, Dr. Okeke. I noticed that Benga Ogunjimi is here. Benga Ogunjimi is the director of the Nigerian Center. And if this question had come up maybe 10 years ago, I think my response would have been just utter dejection, and I would have said, we have no options. Thankfully, that's no longer the case because I think the Nigerian Center, in the last 10 years, certainly, I've seen a significant change from a situation where, as Nigerian Americans, we were not very civically engaged, quite frankly. 10 years ago, if a Nigerian told you they were going to run for office, what they meant was that they were going back to Abakaliki, or they were going back to Kogi State, or they were going back to Lagos, and they were going there to run for office in Nigeria. Today, when a Nigerian American tells you they're going to run for office, the likelihood is they're trying to run to be the US representative for one of 4 congressional districts in their state, or they're running to be mayor. So there's a very different level of civic engagement that we have now. 10 years ago, I don't think we had a NAPAC. Now we have a NAPAC. We're more politically engaged. I recall, Dr. Okeke, you were, before folks came on board, we were talking about the first time we met, which was organizing around Black Lives Matter. This was something, 10 years ago, I don't think we would have, we watched these things happen. We were consumers of news about things that were even going on around us. But I think there's a very different level now that I see amongst the Nigerian community, Nigerian immigrants and Nigerian Americans here. A very, very different level of civic engagement, one where we're more involved. And, I would just piggyback on what you've said, that I think organizations like the Nigerian Center, which already, by the way, offers free legal advice for people who have immigration issues. They have immigration clinics that anybody with issues can just go to. You don't have to pay. There are lawyers that are supported, whose time is supported and paid for. And I presume some of them might even be volunteers that actually support that you can have those conversations with. The Nigerian Center is very actively involved, along with other Nigerian organizations. We're no longer just consumers and recipients of policy initiatives. We are also actually starting to shape them. And I know that the Nigerian Center, for example, recently was involved in advocacy around TPS and certain other policy initiatives. So I would, the type of stuff you described, Dr. Popola, does not yet exist, to the extent where you can pick up the phone and you would have, no matter where you are in the country, some number you can call and you know that you have somebody on your side. But given what I've seen in terms of growth, and given the work that I've seen organizations, again, like the Nigerian Center do, I believe those are things that we can actually grow into. So, Benga, I don't know if you are able to come off mute and perhaps quickly, Dr. O, if that's okay, introduce yourself, introduce the center, and it may be possible that some of these things we're talking about are things that are already on your docket to address.
Absolutely. Yeah, Gbenga should come on. But even before Gbenga comes on, Gbenga, kindly unmute. I want to say that, the analogy you made is perfect. I like that you picked the Jews. But I want you to look at the Jewish community and the Nigerian community. The Jews contribute money. These things take money. What we're talking about takes people, it takes money. They contribute, they are wealthy. Nigerians would not participate. The average Nigerian will not participate in anything until they get into trouble. Then they source in for assistance. Nigerian Center is there. We've been talking about it. How many people have contributed to assist this center? We have a lawyer there that is there for free on Thursdays. And if you call in virtually, it's only $55. But who offsets the rest of the funds? So this structure is there in Nigerian Center, as Dr. Okeke and Dr. Fabiyi had said, but it needs funding. We've got to step up so we can have community as strong as the Jews. We've got to dip into our pockets and we've got to lend our support, volunteer time, when you can, and stuff like that. And thank God for NALA, the Nigerian American Lawyers Association. I know that Attorney Richard Aganga Williams is most likely on the platform. He's always on Medical Mondays. I know he's here. I just want to say thank you, sir, for all you do supporting us at the Nigerian Center. Gbenga, kindly unmute and say something to this effect, because these are things that is being done to some level already at the Nigerian Center.
Well, thank you so much for the opportunity to be a part of this conversation. I should say that it was so refreshing and encouraging. I joined at the tail end of Dr. Malcolm's presentation. It was so positive, just kind of just reassuring. So thank you so much for that. So I'm the executive director of the Nigerian Center, and I think God's in his foresight, kind of allowed the center to happen 3 years before this new incoming administration. And we have directly, we have taken on about 400 cases nationwide, immigration cases. We have led both at the federal level and at the state level about 5 policy initiatives at the center. And we have also helped with like civic engagement, kind of preparing us for this particular time. So I'm so thankful for that. One of the things that I saw other communities started to do was they started to invest and crowdfund heavily around immigration. Some even went to the extent of calling it Immigration Deportation Fund. And they are raising millions of dollars in defense to protect their community. The center is still largely volunteer-led and supported. Our board members on the platform, really underwrite a lot of the work that we do there. And we are thankful to organizations like NANA with technical expertise towards the center. So in the coming days, we are launching a 800 number, national hotline that folks can call. We'll try to increase our pro bono cases to the capacity that we have. Our responses, we call it National Immigration Assistance Fund, so we can increase representation as much as possible. And with the policy initiative, we met, what was last week or 2 weeks ago with this administration to see what kind of emergency protection we can get for our community. Other groups are doing the same. Next week, Congresswoman Yvette Clarke out of New York, she is writing a very strong letter to the administration, and she is recommending with several members in Congress to at the very least designate Nigeria for SSR, given the economic situation we have in the country. I say all of that to say we do have an infrastructure, both to organize grassroots, to provide direct services, and also to organize upward towards like congressional and policy initiatives. So we do have that, and I think Dr. Nkem, we do have a working relationship with the Nigerian embassy. Now, we didn't have that before. So we do work with them now. And with the embassy, I should mention that they are like a diplomatic entity. They do have limitation in terms of providing social services to American citizens or residents, which a lot of us are right now. So typically, organizations like the embassy would collaborate with that country's community center. But we do have that relationship now. Are we at the point where we are getting support from the Nigerian government? It does not exist at this point. But I'm so thankful that we have the foundations to protect and to provide support toward this unfolding uncharted territory we're about to come into. That said, Dr. O, please allow me to make this plug for Giving Tuesday. Tomorrow is Giving Tuesday. Please consider Nigerian Center in your donations as you support nonprofits across the country. Our website is nigeriancenter.org/donate. The fund will allow us to continue to do all these things that I mentioned. I should also mention lastly that the IRS has designated Nigerian Center as a community IRS center. So starting from January 1, you are able to go to the center to file your taxes for free. And it's not just limited to DMV residents. We also take virtual applications across the country. And that is significant because what we have seen, when folks are trying to get regularized, they're focused so much on the green card, they don't file taxes. But now there's no excuse. You can get that services done for free at the Nigerian Center. So I hope I touched on as many things as I could. Thank you for the opportunity, and I'll be in the background to answer questions via chat. Thank you, ma'am.
Thank you so much. Benga, please put that link in the chat box for us. Appreciate that. And
Sorry,
please.
Dr. O, if you may, there was if it's okay, there was one comment you made, which is important and true, but which I am also encouraged can change. You'd indicated that we do not put our money where our mouth is.
Yeah.
That we're not, we don't seem to have a habit of putting funds into community-related things that can help move us forward, like the Nigerian Center, like some of these other organizations that are springing up in order to help and support the community. But what I've also seen is, very many Nigerians in Nigeria, we're doing things differently. As I said, over the last 10 years, I've seen a lot of changes. We're more civically engaged. We're giving more to political causes in this country. We may not give to political causes back in Nigeria, but we're doing that more often now. And again, in the last 3 election cycles, I've seen situations where we've raised decent amounts of funds for different causes, for different individuals. We certainly have a habit of contributing in our cultural associations. We have a habit of contributing when it comes to matters that are spiritual and, perhaps religious. And I think this is a new culture, right? We're developing a new culture where we have, again, organizations that are not linked to any religious group, that are not linked to any state or cultural group, that
Like
are
NAPAC.
intended to be for, like NAPAC, that are intended to be for all of us. And I think it's a new thing we're learning, which is, how do we raise funds for these organizations? And the organizations, and I think we need to learn. So, for example, one of the things I would say, Benga, you are here, you are executive director for the Nigerian Center, is I have certainly not seen our organizations try to raise money as aggressively as I have seen other groups do for themselves. So I've got Jewish American groups, I've seen Turkish American groups. So they are very much more aggressive in terms of how they raise funds. Much more, there are a lot more events. There are silent auctions. There are like 1,000 different ways. You buy tables, you do silent auctions, you have causes, and you endow, you provide endowments to support particular issues and causes. Those are things we're going to have to learn. Those are things we're going to have to adopt. Those are things that, quite frankly, we don't do a lot of now. But again, I am encouraged by what I've seen over the last few years in terms of how much more of those things we're doing when we become aware that the need exists and when we're asked to actually step up.
Thank you so much for that comment. And what I really love is the fact that you identified that we are not aggressive as other communities you have seen. The thing is, we actually are. It's just that it's a few of us that are still donating. I will call you in a heartbeat and say, hey, this candidate, or this project, we need to do it. Can you do it? Immediately you will sell the money. Within 30 minutes, you will. And that's reciprocal. But the rest of the community is not doing it. And we need to change. This is the time to change. And let's start with Nigerian Center. It's the time to change. Everybody needs to pull their weight and donate. It shouldn't be a handful, a handful. NAPAC, Nigerian American Public Affairs Committee, do a lot in the community. for people running for office, social, awareness and stuff like that. But it's always a handful of us that are always contributing. We've got to change that. What Dr. Pokuola proposed, what he said, can be done. It's going to take money. When you call somebody and they show up, you're able to call somebody, guess what? The people that at least you got to pay a stipend because they got to put food on their table. We're talking about these lawyers, yes, they're donating their time. We need to pay some to them. So anyways, Dr. Pokuola, I'm going to come back to you. I'm going to call on Dr. Ogunleye. But geez, I'm sorry, Dr. Ogunleye, I just remembered something. Please, 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 I think we all need to understand something about the Nigerian embassy. The Nigerian embassy is Nigeria in America. Nigerian embassy in Germany is Nigeria in Germany. Nigerian embassy in London is Nigeria in London. There's so much they cannot do. What Nigerian Center is doing, a lot of things Nigerian Center is doing, Nigerian embassy cannot do it. The functions are different, but we get that wrong. Like what Dr. Pokuola just said. Sorry, you get into trouble. Don't call Nigerian embassy. It's not their job. They will not be able to help you because they cannot cross that diplomatic line that brought them to the country.
Which is true to all, but the one thing to also remember, if we're talking about something sensitive like immigration, then you've poked Nigeria. And I say this to say because in Nigeria, as an American citizen, I knew times I went to the embassy because there were issues I had in Nigeria, right? So you're right, there are boundaries they can't cross, but if you have to deal with immigration as an issue, the partnership with the center and the embassy will be very helpful.
It is forged already. They have a tight, relationship. Thank God for that. The embassy has actually been, doing amazing, pulling their weight to see that they support us as best as they can without crossing lines. And when they know that a line is going to be crossed, they actually communicated that we can't do that. And, so thank God, like Benga said, the relationship is good. Yeah. Dr. Gulaye, you can unmute, please. Yes, great. And ask your question.
Hello, everyone.
From California. Why do you have winter cap on in California? Is it cold?
Not that cold, but
well, cold enough.
I just want to cover my head. So 3 things. The first one is the federal government is not going to come to, say, California, for instance, and start arresting people off the streets and locking people up. It is usually the overzealous supporters of the coming administration that will do it at the local level. It is your neighbor, your co-worker. Because when I read the diary of Anne Frank and other Jewish experiences back during Hitler's time, it wasn't Hitler himself that was doing these things. It was people at the local level, people you might have wronged, that would just call a number and get you arrested and deported. So let's watch out for that. Secondly, I want to speak on behalf of Nigerians that do not donate. I think Nigerians are still a little bit more generous than other African countries when it comes to giving money out. I also want to say that we do not have a social security system in Africa. We are our family members' social security. So for people that have a lot of responsibilities back home that are paying what you can call salaries to relatives back home, I think we should cut them some slack. So when we're critiquing each other, let's keep that at the back of our mind, that not all fingers are not equal. Some people are still struggling in America. In fact, I'll say a vast majority are still struggling in America to make it. Thirdly, Did I even forget what I wanted to say? Third one. Aha, the Nigerian embassy. If the Nigerian embassy is Nigeria in America, and a Nigerian is in trouble, he knows that they're coming for him. Can he run to the embassy and get protected? See? So it's not Nigeria and America.
No, it can't. Like a German who gets into trouble, who maybe does something fraudulent, cannot run to German embassy to get him out of it.
No, I'm not talking about fraudulent. I'm talking about this deportation nonsense that might be coming down the pike.
It is still trouble. It is still trouble because I've worked with lawyers a lot. And when you are in a country and you are illegal, then you violated a rule, a law.
Doctor, I'm not talking about illegals, though. I'm talking about people like me who came in legally and even served in the military. Now they're saying that they're going to probably strip us of citizenship. I'm talking about people who did it right.
Okay.
What if his overzealous supporters decide, oh, we don't want you here either?
Let me answer that question. First of all, the law of the country of US is still the law of the United States. Nigeria cannot come and change that law if there's a law on something. That's the first thing. They can't. Nigerian embassy cannot do that. Nigeria cannot. Now, people are saying these things, they want to strip citizenship and all. It's one of the purpose of this conversation tonight. Let's wait and see. I love the way Dr. Fabiyi had addressed that whatever is coming is still going to take a process. We don't know. People are speculating a lot and they're creating anxiety. That's why we're here. We don't want to be anxious. It's a mental health issue. Let's remove that fear that people are perpetrating in the social media. There's something I saw on social media that President-elect Trump appointed a Nigerian into an office. They were broadcasting this thing. The guy had to come out and say, no, he was not appointed, nothing like that. It was fake news. Let's be patient. Your point is excellent that we have to be careful because it's, overzealous people that may call ICE or call immigration or something or someone or somebody who knows somebody is illegal and all. That is happening already.
So, Dr. O, just to address her concern, if you don't mind me chiming in, I think raises a valid point because we're just a handful of people here. So some people will assume if they had such a concern, they should go to the embassy or reach out to the embassy. So in that case, I think, again, the partnership with the embassy, with organizations like the Nigeria Center, will be great because they can have information to provide them information of these are the limitations of what we can't do. However, let me refer you to X, Y, or Z and take it from there. So even them having the information of not only the Nigerian Center, but any other ally organization is good information so that when people do reach out, they just don't leave empty-handed with, I can't help you. We can't help you, but here's a number you can call. This is where you can go. This is the advice I can give you. That would be helpful.
Dr. Okeke, thank you. You hit that on the money. I'm going to talk about from personal experience, and Gbenga Ogunjimi is my witness. An incident happened at the Nigerian embassy that was above their purview. They called the Nigerian Center and asked us to step in. And we stepped in. We did our part. They did their part to collaborate and resolve the situation. The ambassadors are meeting with different organizations. They have met with NAPAC. Your organization is to meet with them. I'm going to set it up, Dr. Okeke. So you can tell them what you can do, because this is what they're doing. They're meeting with different organizations to see if there's a need. And somebody comes and there's a need, so they can appropriately channel them to where the need is. And Dr. Pokuola said this. Thank you for collaborating what I said. I'm saying it because I've met with the ambassadors and they have directed and redirected us. So we understand how much they can do. He said, very correct, Dr. O. We had a discussion with the Consular General at New York. He enumerated the limitations Dr. O stated. However, we must notify the Nigerian governmental apparatus about what we are experiencing and what they may document for further diplomatic engagements. They will do that.
Awesome.
So thank you.
So shifting gears a little bit to what Dr. Guleye said, she said something that's very true. Sometimes we assume we don't donate because we don't care, we're not engaged, and sometimes it may not be true. We could be really sending money home, we're still struggling, and that's in part why, to be honest with you, why Bind was also formed. How can we talk about generating that money to be donated as opposed to just asking me to give you money? I don't have to prove that I help people, and I help good causes. The fact that it didn't get to the one you care about doesn't mean I'm not helping. So I think the point we started thinking is that, okay, how can we also have a conversation of how to generate these funds and generate wealth amongst ourselves so that donation is not only the issue anymore, it's just part of what we do. And hopefully those kinds of conversations should come up just as often as we ask people to donate. So for us who are in leadership, and I know we do this in pockets, but now with the climate, it just heightens it, who's in a position of power that can make sure that the next person coming in is going to be a fellow Nigerian who is qualified to be there. The white people do it with themselves, no excuses. The Jewish community we're admiring, money doesn't leave their circle for 10 passes before it goes out of their community. That's why they're wealthy. How can we begin to think through those kinds of things and make it more endemic, if I would say, in our community, so that way we're just richly blessed to support whatever cause we want, including what the Nigerian Center does.
That is
I don't
fantastic.
end up this meeting, Dr. O. Thank you.
No. They say
that's why I do what I do, because
yes.
if I can't bring you success, how can I come back and ask you to contribute towards a cause? It's not fair. I don't even know if you can afford your next meal. It's just.
Dr. Guleye is right on the money. When she said that, I get it. It's just that it becomes heavy also on people who are contributing all the time. People contribute all the time to different organizations. They're the ones carrying the weight here, there, and there. It becomes challenging because everybody needs to put food on their table. And so what you said is very important. People say health is wealth. Wealth is health also.
Yes.
When you don't have money, it creates health issues. It creates problems. So we're gonna tackle this, and this is what you do. So you have to come on Medical Mondays to come teach us how we can use our hands to make that wealth. I'm gonna
Sorry,
ask.
Doctor, just just very quickly, so just to make sure we have some action items, I think one thing that is going to be necessary is there are a number of things we've speculated about if we have these issues, who do we go to? Where can we expect help from the embassy versus where we can expect help from other organizations? So, Benga, I don't know if I can put you on the spot, but I think it would be great if perhaps the Nigerian Center can take the lead in helping to put together some type of cliff notes, cheat sheet, framework. These are the types of issues people might have, and here are the organizations that can help. This is what the embassy can do. This is what Nigerian Center can do, and this is what maybe NALA can help to do. Just some type of guidance document, a one pager so we know what's already going to come. Some of those questions have been addressed. Some of them might be things that, have been percolating, but a number of issues have already surfaced today. And I think just being able to gather that information and make it available would be helpful. There's, again, without belaboring this issue of giving or not giving, there are people who give $1 to the organizations they support. There are those who give 100. It doesn't really matter how much we give. What's important is that, we think giving is worthwhile. But I can't give, there's a point you made, Dr. Okeke, which is true. I can't give to something I don't know about. So I don't know how many people of the 47 of us on this call even knew of the Nigerian Center and what they do. I would guess that some of the things Benga said today is news to many people. So if I don't know what they do, if I don't know what impact they have, why and how would I even give to them? Even if giving was $1. Dr. O, you mentioned something earlier that, every time, there are a number of people who carry most of the burden, and that we're not aggressive enough. And I'll tell you what I mean by aggression. Nobody has ever told me, Malcolm, I want you to get 10 more people to give.
I have.
So, yeah, but it's convenient for me to give. But if you harass, if an organization tells me, so I know of other organizations that have basically said, we're interested in what you give, but we're also interested in having you leverage your network.
We
So
do.
oftentimes, but Dr. Olam, I think the bottom line is whatever we give, there's still more that we can give. And what I'm saying is that I have seen other communities use methods that we don't use. It's not the size of the giving. It's also how much of our networks we leverage. There are some people who would have giving circles. One person would go and we just want you to get 10 more people. One person would go, we want you to get it. There are different things we can do. And it might be worth a conversation amongst, people like Dr. Okeke and others who have experience in these areas for us to take all the organizations we have, sit ourselves together somewhere and ask ourselves the question, how can we improve on one, how we generate awareness about the work we do, and two, how we get more support. Support doesn't always have to be financial. It can be people giving of their skills. It can be people giving about, giving other types of resources that they might have. But I think there would likely be value in us finding ways of just enhancing how we're able to engage with the community, inform them about what is done, provide them with a sense of what resources are available where, and then also think about ways in which we can also get the community to support these efforts that we have a lot more and much more efficiently than we're currently able to manage.
So Dr. Fabiyi, yeah, thank you for that. And I want to put a plug in and not to put Wenga on the spot, but happy to talk offline. But the truth of the fact is every time you form an association and your revenue stream is not clear, you're not going to be sustainable. It's pure business. So I think when you talk about people contributing money, how many people, is it $1, $10, whatever, there has to be an organizational target, goals, and those goals are tied to funds that needs to make it work. So the revenue streams are multi-layered, but one of that I have learned, at least by founding Bind, and it's an association of businesses. So it's non-profit itself, but businesses therein are for profit. But to leverage that position, we have sought grants that are carved out for what we do and applied for it and got those grants. So same thing here. You have development banks that are waiting to hear what you're doing, that they've been looking for an opportunity like yours to fund it. So I think though, and we're talking serious money that can really drive, sustainability that we're looking for. So yes, while fundraising is important, it shows beyond just fundraising, bringing money in, commitment, engagement, building the community. There are also ways that one can seek money that is really carved out for what we do, which can fall into different things. I mean, now we've been approved to be an IRS center where people can, you can just even begin to package the body of work that you have already to position yourself for a carved out funding that's just for you. So open to talk more about that being offline, but different revenue streams is what I'm advocating for while we wait for people to learn more about the center and also contribute as they see fit.
Thank you so much. Wow. Gbenga, I'm going to call on you in a minute. However, because we're still on this subject, Dr. Pokuola wrote in the chat box that will Nigeria Center also help collate Nigerian social and professional organizations that may work with Nigerians in need? And I responded that they're already doing that. Do you know that the center partnered with a bank that when people come, they just come from Nigeria, instead of going to drive cabs and all of that, they can get jobs at the bank and then move up. They've partnered with NALA, AMPA, there's somebody who needs to navigate the medical area. They just came. They will connect them to AMPA. NALA, they have the lawyers donate to them already. You can get loans from Nigerian Center when you just come to build your credit, from like $500 loan to $250,000 without collateral for your small business and stuff like that. The list goes on. So it talked mainly about immigration, having serviced 400 people. I know how many people I've sent to Nigerian Center, and by the grace of God, honestly, every one of them, 100% got result, not 99.5, 100%. So there are many more things, and I'm sure I just scratched it on the surface. So Dr. Pokuola and everybody on the platform, Dr. Fabiyi mentioned that also, that if you don't know about what people are doing, you may not want to support them. When you don't know, how would you support them? So I'm excited that we're talking about Nigerian Center, to know what has happened at this center. And this is a young man who came to the US within 10 years of him coming, thought of starting Nigerian Center. And, actually the same year, 2.5 years ago, when it started, the mayor of DC declared October 1st Nigeria Day. Now they've changed it to Nigerian American Day. It's Nigeria Day. So because that time, I'll stick with that. Within months, from February, when the center started, to October 1st, 2.5 years ago. And since then, I mean, it's just been, growth. So I agree with you, though. We need to look at this development banks. This is our source. Somebody mentioned, I don't know if it was you or Dr. Fabiyi, that Nigerian Center needs to have branches. I think it was Dr. Pokuola, branches that people can call. Nigerian Center is ready to do that. Gbenga's talked about that, but it takes funding to do it. So with that being said, I'm going to go to our able chair of NAPAC in New York, Gbenga Omotayo. Kindly unmute. You have the floor, Gbenga.
All right, thank you, Dr. O. Good evening, everyone. Apologies, I can't unmute. I can't show my face.
Your camera.
Yes, but thank you, Dr. O. This has been impactful beyond the topic. And I want to thank our two speakers, Dr. Fabiyi and Dr. Okeke. I listened attentively. You had both come at different hands, and both of your approaches. If this can be documented, filter down to people beyond this group, because I want to believe that majority of the fare is outside of this group, the people who are mostly undocumented. And we need to let them know, because like Dr. Fabiyi said, those are practical steps that people need to be aware of. This fear thing can be very damaging. We're scared of what we don't know. And at the end of the day, things don't usually go the way people say it is. So it's good to know that. And like Dr. Okeke said, it's good for you to prepare yourself. Do what you can. and what you cannot, leave it to God. I'm a man of faith as well. Most of us didn't get to where we are today, if not for the grace of God. And we also need to understand that, I mean, from the point of a faith person, God placed people in a place of authority, especially in a country like this. And God knows what He's going to do. And God will take care of His people. I'm not really worried, but that's not to say we shouldn't prepare. But I'm happy with what I heard today. And so, like the topic had said, fear, these are negative emotions. This can be damaging to our health. When we worry, we have anxieties. The medical professionals have said that if you worry too much, it can lead to medical situations. So people should just do what they can, and what they cannot, let's live it. And let's be hopeful. Like Dr. Okeke said, let's pray and hope for the best. So that's that. But my suggestion is, thank you to Mr. Benga Ogujimi for the work you do. What I would suggest, Dr. Ho, that this conversation should be taken to like a town hall settings to a broader population. Because again, like I said, the people who need to hear this, they may not be here. I think we should take this conversation to a larger space so that more people can get to know. It can be hosted by the Nigerian Center, and then do like a large Zoom. We can all, promote it. And in addition to what Dr. Fabiyi said, let there be like a resource place on the website that people can download on what they need to know and what they need to do. And beyond that, let's reach out to the Nigerian consulate, the Nigerian embassy. I found out that most of the times they want to do stuff, but they don't know how. So it's like they're in a place of authority, but they really don't know what they're supposed to do. We should take this to them. There should be broader town hall meetings as well. In New York, we meet every month with the community. I tell you, this type of conversation, they would love to hear it. And a lot of the people would be blessed with that. So thank you, Dr. Ho. This is really powerful. And God bless everyone. Thank you.
Thank God. To God be the glory. Thank you. This is this is on YouTube and it's on Facebook. It's recorded live as we speak, but it will be on there. For past episodes also, if you just search for Medical Mondays with Dr. O, you can always access this. So for people you may want to share it with. But I agree with you, we need to have more dialogue because this is just the beginning. This is just laying the foundation. We don't know what would happen. We don't know what will materialize, but I share your faith that the Lord got us. The Lord got us. Thank you so much. Your words are comforting. You all, Dr. Fabiyi, Dr. Okeke. I mean, even me, I just felt at peace. I'm grateful for all of you. Your words have been very comforting. Dr. Guleye, kindly unmute.
Okay, I'm back again with this question of money, money, money. And I'm going to address directly Dr. Fabiyi and Mr. Ogunjimi. So hear me out. People respond to stories, especially heart-wrenching stories. Okay? So, you might want to find a family or 2 or 3 that you've helped, that the Nigerian Center has helped, and put together a powerful story. Let them tell their story, kind of like a short documentary clip, right? Well, my daughter is one of those Hollywood people, so I listen to her a lot. So put together a story, and at the end of the story, ask for recurrent donation, no more than $5. No more than $5. The population of Nigerians in America today is at about 379,000. Now, cut that in 3. That's about 125,000 people. If each person donates $1 a month, you'll have $125,000 coming to the Nigerian Center every month. Now multiply that by 5, please, and tell me you will still be asking for big donations from a few people, you know? And those few people will now be able to rest and relax. The problem we have in the Nigerian community with fundraising is we ask for big money at a fundraiser. And then we have people competing with each other to donate bigly. Let me use our next president's words. This one will come and say, I donate 2,000. That one will come and say, I donate 500. This one will say 250. And the little guy is sitting there and going, me, I better not even say a word because I cannot meet up with all these 500, 200, $1,000 donors. But if with that documentary and asking for just $5 recurrent, or even if it's $1 recurrent, I bet you some people will do it mindlessly. And they won't even bother checking their account every month because give me $1. What's $1? Give me $1. So that's one of the ways that these other organizations, American organizations, raise funds that I have seen. Because they don't come out beating their chest and giving 5,000, 2,000, 3,000. They ask the little guys for $1 and they get plenty of it. So mind the pennies and the dollar will take care of itself. Thank you.
Wow. Wow. Whew, thank you. You know, something about Gbenga you should know also is that he's a storyteller himself. But, you know, doing this clip and him with his God-given storyteller gift, ability, and these are truths. These are factual. These are real people that have been helped. It's a win-win. It goes back to what Dr. Fabiyi said, though, that, you know, you do it, call on 10 other people so we can reach that 125,000. Call on 10 other people to do the same thing. I would say maybe $5, $1, $5. $1 to $5, you know, per person. Fantastic. Thank you so much, Dr. Gule. You know, all these brains, eh? Olua, thank you. I praise God for you all. Gbenga, are you there? I hope you're taking notes. This is okay now. We have a financial guru, Mr. Reg Imodi. Kindly unmute. Now, you have the floor.
Good evening, all.
Good evening.
Thank you so much.
He's with Bank America.
On the exit now. You got my email, but
Ooh, you told me, you told me
yeah,
actually.
this is a great conversation, you know, and I wanted to piggyback to the last speaker in terms of small amounts. I think one of the challenges is really the wide reach out to everyone. And I was just thinking along that line, things such as a telethon, maybe dedicate 2 or 3 days nationwide to reach out to a wider audience. And the fact is true about the smaller amounts. Imagine reaching out. So, you know, I was just thinking about that, and maybe that's something that we need to try as well. Telethon.
What is telethon?
Well, where we dedicate about 1, 2, or 3 days telephone calls, maybe from the Nigerian center, and then reach out. It can be broken down into states. There's a lot of Nigerian Americans in the country. But there's got to be a structural way to be able to reach out to everyone. And again, underscoring the smaller amount is also important. But repeating those amounts on a monthly basis, I think you know, that's something also that we need to factor in. This is certainly a wonderful conversation taking place tonight. Thank you.
Thank you very much. Thank you for that robust contribution. Dr. Jagbe, kindly unmute.
Greetings, everyone. I'm very grateful for the opportunity to be here tonight. I usually don't try to engage in political discussions, but since this has a slant towards health, and that's why I'm participating tonight, I probably want to just ask the first question. Is this focusing only on Nigerians? Because I know there are other people who are not from Nigeria on this platform. Because we talked a lot about Nigerians, which is okay. We talk about Nigeria issue, that we need to also consider that there are other people who are not Nigerians who may be participating in the discussion. So,
can I answer that one real quick?
Sure.
Okay, it is not limited to Nigerians. A Nigerian center is not limited to Nigerians. I have sent people from other countries. Nigeria Center caters to anyone that needs the help. They don't have to be Nigerians. And none of this conversation we're having is limited to Nigeria. The reason we talked about the Nigerian embassy was because of the specific statements that question that was referred to Nigerian embassy.
Well, okay, so thank you for answering the question. So it's not just a Nigerian matter. This cuts across every nation in Africa and anyone else who may be affected by whatever the consequence of the recent election may be. I just want to make a comment, and I know that a lot of things have been said about the possibility to raise funds. Fundraising without a lot of awareness may not be as effective as it should be. The awareness in the community about, what can be really accomplished, which is everybody seems to be pointing towards, a Nigerian center because that is available and is visible enough now to be able to do something. So encouraging Nigerian Center is a no-brainer. And I think everyone who knows about Nigerian Center will want and knows exactly what is going on through awareness will definitely be in support of that organization. And I believe there are other organizations that need to also come to the forefront, which we may not know yet. And then we need to make it easy for them also to actually come to the forefront and be advocates for the community as well. Thank you.
Thank you. Thank you very much. God bless. My big brother, Brother Tai Doherty.
Okay. Let me unmute. Yeah, good evening, everyone. I joined it late. I think I joined in the last 15 minutes, or I think I caught enough of the
You've missed a lot.
I caught enough of the gist, and I know what Benga does to be able to know what we're talking about. I'm in support of stories. Stories is very good when you're trying to raise fund. And also I'm in support of recurring donations. I worked 30 years in capital raising. The last 4 or 5 years, I'm working in fundraising, and when you compare capital raising, people are concerned about how much X are you going to get me? It's going to be 20X, it's going to be 10X, it's going to be 5X, and that's what motivates them. In fundraising, on the other hand, you go through the same steps. It's who it's your network, but the end goal is a little bit different. The end goal is more of a social good. People want to feel good that they're able to impact other people or other lives. So that's what people are looking for when you're fundraising. Unfortunately, the only community that is very attuned to any kind of fundraising is the Caucasian culture. Our culture is not. We need to build that, to inculcate that. Asians are not, they're even worse than us, But I've sat here sometimes and people come up with a great idea, and then it comes down to, oh, let's go get some grants. And I laugh, because even when you go seek grants, they want to know, do you have a skin in the game? If it's that important to you, how much of your own money, have you put in? So I think there is something we need to inculcate in our culture. Nobody's going to build, just like we talk about Nigeria, we talk about Africa. Nobody's going to build Africa for us. We have to build it ourselves. So I go to some, people think somebody's going to come from the outside and build it for you. It's never going to happen. It goes down to that Zulu saying the Ubuntu, which says, I am what I am because of who we all are. Now when you're doing fundraising, it's got so many components to it. I had a conversation with somebody today who brought somebody to NAPAC when we did our annual general meeting in Atlanta, I think like 3 or 4, 5 years ago. And they brought some doctors from North Carolina who are Caucasian, and they made donation to the foundation. And for some reason, they haven't had anything back. So when you're doing fundraising, there is the cultivation aspect. You have to keep cultivating people. There is the stewardship aspect. There is the annual report that you send out, so that people, remember I said, it's a social good. The end goal is a social good. People want to feel good that they're able to impact either other people's life, their community, or whatever it is, So they need a report back, Even when you do seek grant, if they gave you a grant, say they gave you $1 million or 500,000 grant today, part of the requirement is you have to tell them about a year later what you've done with the money, so that then they could decide if they want to if they want to do it again, renew it, or not, So you have to, and we all lived in this country for a long time. People send you, they seek money from you, or they're trying to sell something to you, and you just throw it away. But they keep sending it every month. But one day, maybe after a year or 7 months down the line, for some reason, something spoke to your heart. Maybe you don't want to buy it right away, but you set it aside on your table, So there is persistence, it's part of it. There is a cost to raising money, If you're going to raise, we just did a gala in San Francisco at the Julia Morgan Ballroom. If you to raise like about 1.5 million, we spent about $500,000, So there is a cost also to raising money, So, but going back to, you have to do a lot of several things that you have to keep doing, and it's a never ending. You keep engaging with your donor, you keep engaging with your audience. Nothing wrong with people donating $1, but you could do both. You do auction. There are some people that would put down 50,000. There are some people that put down 10,000. You could do both. Recording donation, there is some benefit to it because it's a never ending. You constantly getting the money. So even if it's $1, it adds up, after a while. And there is a reason a lot of the new Silicon Valley company, they have this thing called freemium, they call it. They give you this service for free, for a while, and somehow you get attached to it. And then when they want to charge you, you don't want to give it up, So it's the same thing that you have to go through. There are so many things you have to do to be able to raise money successfully. But the key thing is our community. We can't wait for other people to do it for us. We have to start doing it. If we see a good idea, like the Nigerian Center, who I'm very familiar with, even though I didn't listen to the presentation, you support it. ask other people to support it. Everybody's got a network. So I think we could debate this till we're blue in the face. We just have to take action.
Yes.
It's like Nike, just do it.
Thank you.
I
Thank
thank
you
you.
very much. Thank you. Actually, the conversation is about preparation, relieving anxiety amongst us, and relieving depression, and basically staying strong and not dying before one's death comes, as far as the outcome of the election we just had and going forward. And, that led to what we need to do to prepare, part of things to prepare our community for whatever, because people are worried about immigration, they're worried about different things that have been talked about. And as speakers, when they round it up, you will maybe, catch into that.
Yeah, I hope I wasn't out of turn then.
Yes, and that's why I'm quickly briefing you. So we will, we identify the fact that Nigerian Center has been given to us by God as, a go-to center and a center that can be a source for immigration and a lot of other things in the coming year. So stay tuned, sir. Hang in there and, as
Okay.
we continue. So, Sister Dr. Buka, kindly unmute.
Yeah, hello, good night, everyone. Okay. It was very interesting, and it was a change from medicine, but if we are
Oh,
afraid,
no, sis, it is medicine.
well,
It's
it is
anxiety
medicine
and
of the mind.
depression that brought us here.
Yeah, medicine of the mind. But there are few things in terms of, I'm not a fundraiser, but I could give a little bit when I had to fundraise for Bryn Mawr. What they did as a parent, they gave you, on a small scale, they gave you about 30 names and a passage to read, and call the people and call grandparents, whatever, and whoever you're calling. And you just read the passage pertaining, if it's a granddaughter or a daughter, and you ask for a donation. And they're like small donations coming frequently. That was a yearly thing. Another way we can prepare is also for some of us to start planting a kitchen garden. We have to grow our own food because we can't afford to go out every day to buy the stuff. So when the summer comes, we need to plant our tomatoes, our peppers. That saves some money. And thirdly, there are foundations, there are areas that could give grant maybe to the Nigerian center. There's the Inter-American Foundation, there's Inter-African Foundation, and these are small, small grants that could help to enrich the Nigerian center. And they could just go on the website and look for them and see what grants they could apply for and use. It would bring some income to the center. That's my little take. Thank you very much. Mm-hmm.
Thank you, Dr. Buka. Much appreciated. Thank you.
One more thing I will add is that we've spent quite a significant amount of time talking about fundraising for the Nigerian Center. But
we don't want to take focus of
the health, political health we came for, right?
Yes.
One thing I do hope that we can all walk away with is that we're all ministers in this fight. And for all of us who have shared the last hour plus together, I think each one touch one is the goal. And each one touch one cuts across a number of things. I may not have an immigration issue, but I do have a concern about just how I have to exist in my space in a predominantly white sector of my work or field of work. As I mentioned, our kids are not immune. So, I mean, just even having, not just now, but ongoing webinars, conversations of how do we encourage each other? How do we talk to one another? How do we learn how to, brace ourselves when we see things and how to address those things? we've already done that organically in our own daily lives, but now it's heightened. And I think just even having that ongoing conversation and each of us being able to check in on each other as a routine, as we reach out to 10 people per day, per week, I mean, or per month, just check in. How are you doing? How to just having that conversation breaks the ice, makes you feel, you're not alone. We may not have the answers, but we can have each other. So I think talking about the focus of the topic of this webinar, which is your emotional well-being under the political climate, I think that we should not overlook that piece as well.
Thank you. Thank you so much. You have a way of, starting these conversations that there's something tying into it. Somebody chatted me that, well, from their experience, people are afraid of coming out. But how can we encourage them to speak out? And that is huge. When people bundle things in, it causes a slew of issues. Mental health starts manifesting physically. So how can we encourage them to speak? If you please tap that, and then we'll have Dr. Malcolm also chime in on that. How can we encourage people to speak?
I think it depends on what you're speaking out exactly about and how you're speaking out about it. I never saw a place where trouble brought peace. So I think it's not what you say, it's how you say it. So it's okay to speak up. If you think you are uncomfortable about something, speak up and say, I'm just wondering, this is a concern I have. What are your thoughts? If it is something that you are experiencing on the job, in the business, find a way to give it voice without coming off brash. Nigerians are known to be proud people. I am. We talk with confidence. They say you're too bold or aggressive. So we have to keep that in mind, that while you have to stay true to who you are, also remember that communication is that my message is understood by the other person in the way I want them to understand. And that is true power. So being able to remember that and then kind of tailor how you say what you say, pick your moment when you say it. I think those are things we have to be more vigilant about and practice even more now than before, because really, who can you go to report those things, right? I lost the contract because I'm Black, she's white, and the judge thought she was right? But lucky for me, I had other connections that I could leverage eventually to navigate. But what if I didn't? But it happened, and it happened to me for just, like they say, koro, and I was confused, right? But again, some things will happen, but you have to pick your moments, you have to strategize. Please speak up. It's not what you say, it's how you say it when you say it that matters the most.
Thank you. Thank you. Dr. Fabiyi.
Yeah, Dr. Okeke was very comprehensive there. The only thing I would add to it is I think sometimes we don't speak up because we might think the things we want to say are stupid. And I remember there were some organizations, either that they are, one, am I asking a question that is out of turn, or the thing that I'm about to talk about might be something that I don't even want anybody else to know I am going through. Right. So it becomes hard for me to speak up. Meet me in another context and I'm the loudest person in the room. But in this particular context, I am silent because I don't want to draw attention to the fact that that's my issue. And I think that might be one place where having resources that people can reference, like some of the conversations we've had around, if I have these immigration issues, I may not want to open up today and tell people this is my situation and this is my fear. But can I go somewhere and find a resource and read through it and know that if I call the Nigerian Center or some other organization or Dr. Okeke's organization, I will get this help, I will get this support? Or is it NALA that I should be engaging with, or is it AMPA? we need stuff like that. There's a, that can enable people to voice their questions in a very private way, because sometimes that's the problem they're grappling with. The other one is also, there's a reason why there are helplines. For especially since we're talking about mostly emotional, psychological type challenges. There's a reason why there are helplines. There's a reason why they're helplines. They're intended to provide, to let people know that, there might be this issue that I don't want to bring to the public forum, but here is somebody who can help with that conversation. And I think, again, piggybacking on, if it was 5 years ago, there was no option I would have said anybody had for an immigration problem they had, apart from maybe going to pay a lawyer to help them go through that. But I know that now there are organizations that can help with that. I can actually tell them, go to the Nigerian Center, and on a Thursday, you're likely to find somebody who can have a conversation, a substantive conversation with you. If you have a tax related issue, I know where to send them now. If they had an issue related to how to establish credits because they're new in the country and they don't know how to navigate that space, they know what to do. But the challenge is, and I think one of the other speakers from New York had raised this, is we know that here, but how many people know that those resources exist? How many people know? So increasing those resources is one issue, and I think we've agreed, and there have been some really great ideas about how we can fundraise and increase the resources that we can bring into bear. But even the resources we have now, how many people know that they exist and that these support structures are in place? And I think we really should find ways of taking the 5 loaves and 2 fishes, or is it 3 fishes, and feeding the 3,000 with it, because it's enough to feed the 3,000 or the 5,000. So let's take what we have, let people know that they exist, and that there's some of these helplines that they can tap into now, and then begin building out this information structure that will let people know that if you have concerns and you don't want to voice them out, there are ways and places and resources available to help you navigate some of those spaces in a confidential manner.
Yeah, thank you. Thank you so much. I want to add that also we need to protect each other. If somebody trusts us to share whatever they're going through, it should be between us and helping them find solution, not now telling the whole world. B does not need to. That is the reason. Let me say one of the reasons why sometimes people don't want to talk, because they don't want to be the talk of the society, and they don't want to be mocked. Thank you so much to both of you. Dr. Gulaye, kindly unmute.
So my suggestion about that short documentary clip will achieve two purposes.
Your camera is not on again. I like when I see you.
So it will achieve two purposes. Number one purpose is because it's a short story and heart-rending one, it will circulate on social media. People love to share things like that. So that will achieve the purpose of getting the Nigerian Center's name and work out there to people. And also the fundraising at the end of it, ask people to donate, because you're doing good things and people want to participate in doing good things. So please take that into consideration. Thank you.
You know what? I just remembered something. Benga talked on Medical Mondays one time. It wasn't even a speech. It was something like this. Had nothing to do with Nigerian Center, but I brought Nigerian Center in, so money can be donated to Nigerian Center for somebody who needed the money right away, so they can benefit from the tax-free or tax deduction, whatever donation. So we talked about it, and I happened to mention that, oh, you can get loans or whatever. Do you know that, like, it wasn't even 5 days later, less than a week later, I got a call from somebody from the Medical Mondays platform telling me that, oh my gosh, that she got the $2,000 loan that she needed. from Nigerian Center, just like that. She applied and she got it.
Beautiful.
It could be to build credit, it could be to do something urgently or whatever it was, but they got it. And that's what you're talking about. Somebody like that can share their experience, and that will be part of the clip.
Okay, so the Nigerian Center is a nonprofit organization?
Yes, it is. It's a 501c3.
Why is Act Blue the one collecting the money? Isn't Act Blue the political money
Benga.
fundraising thing?
Benga, where are you? I don't know.
Because
Dr.
I did a recurrent
Yeah.
and the Act Blue was the one responding to me. And I
It
go,
was.
uh-oh.
It is. It is. I've donated through. Benga, kindly unmute and answer that question. Thank you.
Yes, firstly, I want to thank everyone
Wait a minute.
actually
Let's see
for.
your face, Benga, if you don't mind. You got away with it last time.
Yeah, I'm not in the.
You're not in a place. Okay.
Yeah, there's a little one here. Yeah, so I wanted to say thank you, everyone, for the wealth of insights and recommendations. I appreciate them greatly. And definitely, I'm a very action-oriented person. So definitely we'll be working on all of them. Thank you so much. Madam, the question, AdBlue also works for nonprofits too, as well as political campaigns.
Okay.
But thank you so much for the suggestion about storytelling. It's my world as well. Dr. Nkem, thank you for the suggestion on diversifying our funding pool. As you know as well, for a startup organization, it takes a while to demonstrate impact, to be able to get grants. And we do have grant funding, we have private funding, we have government funding. But I think our biggest opportunity that is yet untapped is individual giving from our community, because we do have that as well. So thank you for that, as well as your recommendation. Just like I'm taking advantage of this moment to deepen our engagement with the Nigerian embassy. That is going to be worked on as well. Regarding collating the resources for the Nigerian organization, yes, that will be done. What we've been doing is we've been acting as the interface, because one of the things we've seen that just putting the information there, sometimes they still come back to us that we're trying to reach these organizations. And majority of these organizations operate like an association, and they may have like a professional 9 to 5 and something they do with the little time they have over the weekends. So the connection gap still exists. So we've been trying to fill that gap like interface, but we will proceed and put that information online as well. Mr. Dorothy, thank you as well for the recommendation of doing both simultaneously. The good thing is, I think we have, and I was in my little time I had prior, that we didn't have the data we needed prior to now, but we have it now. So I think we're in a very, very good place right now. Dr. Malcolm, I can't thank you enough, for your leadership, and Dr. O. Now, regarding like the donations, and no matter how small, no matter how, just my challenges, for those of us who are able to, Nigerian Center is a 501c3, donations are tax deductible.
You're muted. We can hear Obatide. It's okay. It's okay. Please. No, nobody on this platform, I guarantee you, has a problem.
Oh, no, it's not that. It's gonna want to take the phone. Yeah. So, man, I just lost my thought. Now, regarding like even just helping to get the word out, Mr. Benga, thank you for the suggestion. I'll coordinate with Dr. O to see how we can make this a much more bigger platform. But still going back to Dr. Nkem, like really working with the embassy to like say, hey, this is the time we really bring our partnership to more forward facing. and just serve as a conduit to all other organizations as well, because we need all the resources that we need for the community right now. So thank you, everyone. Once again, I'll go back to mute.
I must say, Benga is very, very humble. The Nigerian Center is now, volunteer-based. This man has quit major job, because it's a lot. Everything we're talking about, he oversees and even does and so on. And it's a lot. I have been saying it. We need funding. He needs to quit everything and face the center and, be adequately paid to do this. And I'm sorry, I'm saying it out front because it's the truth. The other people working there, it's all volunteer basis. We really need to step up the game. This is the time to do that because we need to be ready. This is our contact place.
So Dr. I think what Ronke had tried to find out from Wenga is the Act Blue, does it connotate anything since it's typically used for fundraising, I believe, for campaigns and stuff? Is it okay that the recurring donation is going through Act Blue? I believe that's her question.
That's her question. Wenga, can you please answer that and elaborate on that, please?
Yes, I believe I did. That Act Blue also.
You just say it's also used for nonprofit.
For both political donations and nonprofit donations. It processes recurring donation, and it also generates the same report for tax deductions. So the platform works for both political and nonprofit causes.
So there might be a need, it's probably going to be a different conversation, but Act Blue also has a Democrat. When I say Act Blue, I'm thinking Democratic Party. So as we expand our base and as we engage more people, we don't want a situation where people are giving and they're wondering whether their giving is supporting democratic causes. I know that's not the case, but I think it's a very important point that both Dr. Okeke and Dr. Ogunleye raised around the platforms that people are using to give. How do we make sure they're as neutral as possible? Because Democrat and Republican money looks exactly the same when you spend it in the market, and we want to make sure we're attracting all of that.
And when if it's helpful, you can look into Stripe, and Stripe has a partner organization called Zephy. The good part about Zephy is that you can actually decline them taking money from your donation. So a lot of nonprofits are moving to Zephy. So Stripe Zephy, and nothing stops you to keep having your Act Blue, account, but you can always redirect that donate button to the Stripe or Zephy if you choose to open an account. It's free, so yes.
Did you say Zephy?
Zeffy, Zephy, and it's co-owned by Stripe. Mm-hmm.
Thank you. We'll definitely work on those suggestions.
Thank you. So on the platform, Dr. Ajay wrote about leveraging collective effort. And, if you can, please read it. All he's trying to say is that when you have more people, 100 people doing something together, it's definitely better than one person because one person would have limited time, energy, and resources. Relying on a single individual risk burnout and limits scalability. It says tap into the power of multiplication. If each person influences just a few others, the network grows exponentially, creating a ripple effect. When we do things collectively, we're better off. Wenga, unmute, please.
Yes. I'm sorry, this is, I hope it's my own Benga.
It's you. You raised your hand.
Yeah, I'm sorry, this is a conversation about fundraising. So this is on the same topic of today. My question to the speakers is, what are the recommendations? Because I took the advice from Dr. O, and I deleted all my news media outlets since the election just for my own mental health. So I stopped watching news altogether, both on both sides, or even international news, Nigerian news, all to get global news. Is that a good thing or a bad thing? So just if the speakers can chime in on that.
Thank you. Thank you for asking that. That's how I maintain my sanity.
Sorry, what was his question again?
So repeat your question, Benga.
Okay, what was your question again?
It's what I told him to do. Okay, so the media was going crazy. So I said, stop listening to news, stop listening to all of those. And so he said he deleted everything, social media, both nationally and internationally. He's asking, is it a good thing or a bad thing? Is that a good advice I gave or a bad one?
It depends. So let me give a political answer before Dr. Fabiyi speaks. It depends. I think it depends. Most of us Nigerians, by default, are really independent. There's part of us that's democratic thinking. There's some issues we're conservative. So we just have to lean to what we think it bears heavy in our hearts in the moment. Immigration is very dear and near to us. We've had families that were torn apart and put apart because they won't give them visas or things like that. And for us, that is it's a bigger issue and concern more than telling me about any other Christian values that may be violated by the other party. So it depends. So if you were disappointed severely by the outcome of the election, give yourself a month. Don't worry, the news will still be there when you turn your TV back on. So give yourself a month to just sort of go through the motion of, okay, it is what it is. And, God, if you willed it, so be it, and give me grace kind of thing. And then plug back in. As you heard, Zuckerberg has already gone to Mar-a-Lago. French Prime Minister has already visited. It is what it is. You can't, they said, you have to keep your enemies close, closer, your friends closer, your enemies closer. So if you think that this is something to be afraid of, that is why you have to pay more attention, because information is power. The more information you have, the more you know how to adjust your navigation as to what it is that you want to do or where you want to land. So that's what I would say. If you're still, gone shy here, then wait another week and please turn on your TV. We need you to do that anyway. You're leading the Nigerian Center, so we need you to know what's coming to plan policy, Dr. Fabiyi.
It's the social media nonsenses and lies is the thing, is the problem.
But it's good to know.
Look at what I just told you.
It's good to know what is being said, because not that you dwell on it or spend your time looking at one lie after the other. But again, if you have the information here and there, you know what people are exposed to. And to Dr. Ogunleye's point, when you're doing that storytelling, you can indirectly refer to some things, including what you're saying, Dr. Ose. We want to promote positive, affirming stories, not things that are unreal or fake, so that I mean, there's a way to still address it, but how would he know if he completely shut off? Like my dad would say, even a foolish man has something wise to say once, in a while. So listen.
Thank you. Dr. Fabiyi.
There's not a lot to add to that. The only thing, so I've done something similar. It was a very, very intensely contested election. And my attitude after those types of situations is, what's done is done. If these things, if the news coming at you is a stressor, then reduce your exposure to that stress element. So I've gone from a situation where I was heavily into the news, trying to catch up to what was going on in the political spectrum a few weeks ago, to one where I engage as I need to. To Dr. Okeke's point, we cannot be in a news vacuum. We still need to know what's going on. There are organizations we work with, there are things we do that rely on us actually, knowing what is happening. But I don't need to have a steady diet of WhatsApp and Instagram and all types of media just floating into my brain and my mind. So what I do now is I engage when I want to. So there will be 30 minutes, 1 hour of every day that I might spend just catching up on what's going on. And if that helps bring down the stress, keeps it within a certain time frame, then if it works, then it's helpful. I certainly do that with. I've done that. So Benga, you can bring some of those things back on, but just choose how you engage and and try to keep it to specific periods.
Thank you. Thank you so much. Ayomide Ibrahim, kindly unmute. Oh my gosh, I think I muted you, but thank you. Sorry about that.
Good day, Brian. I'm adopted son to Dr. Ho, even though I can see the look on her face. Who is this?
Yes.
I'm sorry my camera can't come up. I just updated my capacity to get ready for the next tax season. And some way my IT guy, I don't know what he did with mine. So he's gonna bring it back on tomorrow. I mean, I love how we are ending this on a very light, smiley mode. When Benga talked about, just shutting up. I made a video 2 weeks ago that if you're interested in a TV, come to my house because I'm not watching TV for the next 4 years. You know, yeah. Thank you so much for your leadership, Dr. O, Dr. Malcolm. What I have to say is about. I want to start with coordination. Uh, Coordination is best appreciated during, a chaos-like situation, right? If everything is okay, we don't really need, we need coordination, but no one is going to appreciate it as much as, the state at which we are. I'm going to ask the question, if the election had gone the other way, are we going to be having this conversation? The answer is no. We would then come together, but this is not what we would be talking about, right? And we mentioned the Jewish community a couple of times, today, the Spanish community, right? Many of them, most of the more coordinated community we have in the world today, they've had to go through this phase that we are right now. When we are faced with truth is when we appreciate ourselves the more. And this is what someone like myself and Benga have been talking about for years. And most, people will just ignore because, as I said, they are valid, points, but are not appreciated at those times. I said something 2 years ago that the major problem we have as an immigrant nation is that first and foremost, we don't regard this country as home. And then when they tell you to go back home, where you regard as home, you're not like, oh, no, I've been in this country for so years, you can't just tell me to go. We need to start prioritizing everything in a way to balance it. That I'm an accountant, for example, right? There's no called return on investment. What we are getting as an immigrant nation is a mirror of what we are investing. That has to change. No government will take us serious if we don't take ourselves serious. I told someone jokingly yesterday, I'm sorry if this is going to offend you. If the white man goes to Africa again today and choose to make us a slave, they will get away with it easily. Because we are not doing what we should do to empower ourselves, both where we call home, which is Nigeria, and every other country that we come from, and even here. We have to change. We have to change. And I want to propose this. I love what is happening tonight. Medical Mondays. This is my first time attending. If we watch movies, when during the when when England was just going everywhere, Wales. You see different armies. They travel to other countries. Can I join forces with you to fight this bigger enemy? We have to start doing that. For example, in my community, I have over 3,000 contacts on my phone. How many contacts do you have on your phone as a business owner, as an individual? Create a broadcast list. When Dr. Who wants to have a medical Monday like this, post it on your broadcast. Bring those in your community to my community. Let's join our communities together. Benga and I, we are proposing something. I bring FinSA Pro, Benga brings Nigerian community. We offer a free service to our communities. That way, those who Benga knows, they know me automatically. Those within my community, they know about Nigeria. I mean, Dr. Malcolm have said this many times tonight. How many people know about Nigerian Center? It's a shame. The number of people that knows about Nigerian Center. So today, it's a big shame. And I'm going to end my thought with this. The next 4 years has the potential to make us bigger and stronger. At the same time, it possesses the ability to weaken us the more. Take us back maybe 20 years. What do we want? What do we want? We have to align our wants with our needs. Else, we'll just continue to be talkatives. And nothing is going to happen. Dr. Nkem, I mean, I don't know if this is appropriate, but I'm going to say it anyways. Thank you. And I love you so much. You have, you've helped, I mean, me. I can say that for myself with everything you talked about tonight. And thank you. I mean, you balance everything. You continually, even though you say it the way it is, closure, you can see some of the things you mentioned. You mentioned about closure. Not many people want to hear that. It talks about how bold you are. It talks about how sincere and transparent you have to say, you know what, this is the truth. Swallow it, and it's going to help you. You mentioned God several times. Shows how much you believe in God, and that God would not fail you.
Amen.
For every of your fights is never going to fail you.
Amen.
Dr. Malcolm, thank you so much. Thank you so much. We don't know you, but I'm going to ask for your address. I'll probably drive to your office and give you a hug. We need to start loving ourselves. Real love.
Yes.
Take it. Benga, I'll see you, my man. Thank you so much, everybody.
Thank you so much.
Okay.
Whoa. But you didn't say you will hug me.
My
Thank
mommy, don't
Now,
worry. I'm coming to you.
He can't be giving hugs and we can't even see his face.
I'm sorry, don't worry. Okay, you know what? I'm going to send one of my videos to the chat, and then you would all see my face. But Benga knows me very well. Dr. O knows me. She's probably just
I
like,
know you. When you started
okay,
talking, I know
perfect.
that's my son talking.
Dr. O,
I just kept quiet. Thank
Dr.
you.
O,
Yes, yes.
yeah, to just buttress what he just said, a friend of mine told me something that really baffled me during the weekend. She said that the Cameroonian community, contribute like $1 when somebody died in their community, and they have 300,000 members. So that's a lot of money to give to somebody that that died amongst them. So if we can have all Nigerians to buy into that and start doing the same thing, I think it will go a long way instead of having this GoFundMe when people die. So how about that?
I think beyond that, I think what Dr. Okeke said, managing one's estate is very important. If you structure yourself, and you know what I'm talking about, get your life insurance in place. We should not be having GoFundMe.
Well,
She talked earlier on, she talked about wealth. And I said, I'm bringing her back to come talk to us because, yes, we say health is wealth. Wealth is health also. And we need to talk about that. But what you said is right on the money, that donating this kind of money, $1, Dr. Ogunleye actually had said exact same thing, gave us the stats of how many Nigerians we have in the US, and if 125,000 of them, which is 1/3 of them, donate $1 each to Nigerian Center. For what we are looking at, Nigerian Center needs to be empowered financially to be able to be there for people who may need immigration help, who may need other help in this year coming or in these few years coming. And we need to really focus on that. Tomorrow is Giving Tuesday. And I encourage everyone to please start by giving something, even if it's $1, $5, I don't care, $1,000 to Nigerian Center. It's nigeriancenter.org. So I think we should donate there, sis, but we should have sessions where we show people how to actually build their own wealth so that when somebody dies in our community, it will not be a burden on the rest. Does that make sense?
And I think donating for death is a cultural thing, and
yeah,
there's
not $1 in this.
Yeah, even if it's $1, we donate and we raise money. When my father
We don't
died,
donate $1. We donate.
when my father died, I got the largest donation anyone had given me personally, and I can see that's the same for a whole lot of others who lost their parent, loved one. And that's what I think we should tap into. I know Ayomide did say that we should wake up, which is true. We wake up when somebody dies. So I think we should stay awake before they die, kind of thing. So I think, but
that's what I'm saying. Stay awake before they die.
But tapping into that part of our culture is huge, and I think, as Dr. Ogunleye said, the storytelling can help do that better. Everybody loves to see how support brings goodwill and prevents a demise or something unfortunate happening to someone. That's how we come together. And I think leveraging that storytelling would tug on people's hearts to donate. That said, as I mentioned before, there are other avenues. This is on YouTube and on Facebook, so I wouldn't just volunteer my phone number. But if Dr. O has the email address of everybody who registered, it's fine to share email addresses with each other. There's more to it than just what the center can do. As you heard, Wenga is already needing resources to do what he can. So while we're trying to also support the Nigerian Center, we can support each other too. And there's some needs that we can do better than the center. There's some things that the center can do better than us. And I think part of what I would say the center can also do is have an inventory of those things. They've mentioned a few already. If you need legal help, Nala can help you. If you need medical help, like you're looking for a doctor, you can go to AMPA. So just even having an inventory of all the different associations that do care or cater to the African community is something that the center can have. We can go online to the site and click and see. Sometimes you don't have to physically go to the center to see information that may help you. So that could be a project that they could start, and by the end of 2025, you see a library of resources that have been gathered slowly but surely over time. So just wanted to add that as well, that yes, that piece of our culture is something we can tap into, and also just being there for one another in ways that make more meaning. I will tell you personally, a lot of Nigerian younger people reach out to me on LinkedIn, tell me what you do, I want to learn how to go down this path or that path, I offer all of them who reach out at least an hour of free consulting. I say in that hour, I will listen to you and I will tell you what I think can help you through my journey. Being in Nigeria, living in Ghana, coming here, I can tell you what I think I wish I knew then to give you a shorter cut to where you need to go. But it's all about that wealth generation Dr. O was talking about. It's about knowing what equity you can build now, because that opens doors if we can do that collectively. So I offer that, and with my peers, my seniors, I share ideas and ask for help, support, advice. I think let the collective of us here walk away with a new friend, a new group of friends. And yeah, we do more than just contribute to the center. We do more for each other, with each other going forward.
Amen. Amen. Thank you. Going forward, that is the thing. Thank you so much. You summarized it. See, I just cut it. Boom, boom, boom. You put it all together. Yeah, we still have to donate to each other. So somebody passes, that's how we say, it's part of how we give our condolences. However, this is bigger. It should be JARA. It shouldn't be the core of what is needed. That's the point I want to make. It should be JARA, just, okay, people are showing love. Dr. Gunleye, kindly unmute.
Yes, ma'am. The community that donated a lot of money, I think she said 300,000 of them.
Yes, 300,000.
300,000.
Yes.
$1 each, that's $300,000. See,
every time somebody dies,
this is the opportunity that NAPAC is missing. And I know there are some NAPAC stalwarts here on this forum. That's why I'm mentioning this. And I've suggested this to NAPAC a long time ago. Diversify your membership. When you diversify your membership, register every Nigerian you can think of under NAPAC.
Yes.
Register them under NAPAC. Dues or no dues, register them under NAPAC. But it's when you want to run for office or when you want to vote, that's when you have to pay dues. Otherwise, you're still a NAPAC member. And so when we need a fund drive, we just ask each person $1. We have 379,000 Nigerians in America. If half of them donate $1, that's a lot of money. I don't know what I have to do to get NAPAC to listen to this sound advice.
Oh, don't worry. You have a new president coming, and
see,
it's on point.
We got $1. Look,
yes.
It's better than paying insurance, life insurance, because when somebody died, you get $300,000. You spend $30,000 for the funeral service and everything. You still have $200 and something thousand that the family can live with and survive with.
No, I'm not talking about funeral fund though. I'm talking about other things that Nigerians, because you know how many Nigerians die every month. If you're called on to donate $1 every other week or every day, sooner or later, donor fatigue, even though it's small amount of money, you start thinking, what's wrong with these people? But I'm talking about, grants, scholarships, and a lot of things that Nigerians could be doing for each other. We could have our own Nigeria space for events. That way, we're not taking our money outside the community. Nigerians love to party. Let's have our own space, our own Nigeria Center in Maryland. When are you going to build a banquet hall? And when are you going to have branches in every state and have banquet halls there? That's another way of making money. Anyway, let me just shut up. Thank you.
Thank you.
Yeah.
So, thank you so much, everyone. We have been here for a while, and I want to call on our amazing speakers tonight to give us their closing statements, what we should take home, the core of what we need to take home for this coming year. This will not be the only conversation we're going to have. Please, doctors, both of you, be ready, because we'll be calling on you again soon as things unfold, that you should come back and encourage us again. So Dr. Nkem, can you please go first and give us your closing statement?
I want to say thank you for the audience. It's late at night, it's Monday. Work is tomorrow. So thank you for spending the time to be here. Dr. O, thank you for your leadership, for organizing this together. To Dr. Fabiyi, thank you for the insights I learned from you. And I want to say that we're all in this together. Regardless of our socioeconomic status, regardless of the color of our skin, who's lighter, darker, who has gap teeth, who doesn't. We're still Black people in America, and we are sometimes mixed in with the African Americans, which is something we have to navigate every time. And sometimes they see us as part of them, sometimes they don't. So there are different levels of discrimination that we have to navigate, our kids have to navigate. And we are just God's chosen people as well. And I believe that's why we always overcome. We break records every day. So let's wake up and know that we are princes and princesses, kings and queens, just ordained by God. And, having faith in Him and knowing that He put us here for a reason. And let's always keep pursuing our God-given purpose is what guides all of us. So even if we're discussing the political health, as Dr. O put it, and our emotional well-being, just be centered, stay centered, whatever makes you stay centered, be centered, because it's harder to push a tree that's standing strong. And we need each other for that. So I hope that this community grows. We support each other. The communities we already have tap into it. And that's the way we can forge ahead to be emotionally strong through this. This will come and pass. I would just ask that we hunker down. Health is wealth, wealth is health. Will you be better off 4 years from now is the bigger question. I say yes. So the question is, let's get to work to make sure that that happens. Thank you.
Wow, thank you. Thank you. Dr. Fabiyi.
I just want to echo what Dr. Okeke said. Thank you very much for the opportunity to engage with the community today. And Dr. Okeke, thank you for your contributions. I also learned a lot, and I'm sure many people were also blessed and better informed with a lot of the things that you shared with us today. I think what I'll leave with is just the fact that whatever the anxieties are that folks might feel, this too shall pass. The good news is this is a country of laws, and change happens, but the wheels, it's a huge ship, and huge ships, you can turn the rudder, you can turn the wheel as fast as you want to, but it's going to take time before that ship actually moves. So there is time, there is support. If history is anything to go by, there will be recourse that folks would have that will address a lot of the concerns that we have. One of the things that I am most excited about, I've mentioned this before, and I'll leave with this, is that we're having very different conversations. We've talked for almost 2+ hours, and we're mentioning organizations that are Nigerian. We're not saying we want to go to some random community center, some random organization, some random group to go seek for help. We're mentioning our own organizations. We're talking about a NAPAC, we're talking about a Nigerian center, we're talking about NALA, we're talking about AMPA. These are ours. They might be young. We're growing, we're learning. There's some great ideas that have come up today about how we might better fundraise and how we might better make the work that's being done known. But I'm excited that these are our babies, these are our organizations, and they will continue to grow. And we are leaning more into the fact that this is as much home as Nigeria is. And it's a change. It's a change in how we think. It's a change in how we engage. And it's really encouraging for me. And I think our children will actually have a much better experience than we had, because there are now more tools with which they can engage. And unlike us, they've embraced this place. They're seeking for office. They're engaging politically. They're engaging in business. They're coming against the challenges that we came across. But they're also finding ways to work within the system, across the system, and around the system to make sure that their voices are heard. And so I leave extremely excited. I leave extremely inspired that, and I echo what Dr. Okeke has said is, if we gather here 4 years from now, I feel positive that the conversation we will be having is going to be a positive conversation. That things, yes, challenges have come, but that we found a way to navigate through them. So again, thanks to everybody for taking the time to attend and for being part of this interesting discussion about how we navigate through these issues and hopefully come out at the other end positive and having experienced growth as well.
Thank you. Jeremiah 29:7 says, "And seek the peace of the city, whither I have caused you to be carried away captives, and pray unto the Lord for it, for in the peace thereof shall ye have peace." As we leave, I want to encourage us to just be praying for America. This is the country we have called home. This is home.
Preach on, Pastor.
Thank you, sir, Pastor. That's my papa. Thank you, sir. It's the place we've called home. Even Nigeria, some people will be cursing Nigeria. Please stop if you're one of those. Don't. Pray for Nigeria. Pray for America. And as Dr. Fabiyi and Dr. Okeke has said, we will thrive. At the end of this 4 years, by the grace of God, we will come back together. Before then, we'll be talking. But we will see, looking back, that we have actually been strengthened, that we have thrived. And like Dr. Cookie gave us different, she scratched it, different strategies to do fantastic in any system. So I want to say thank you so much, Dr. Okeke, Dr. Fabiyi. Wow, may the Lord bless you both. May you continue to be blessed beyond your wildest dreams. The Lord would enlarge your coasts. In this era, beyond this era, you will just continue to blossom in all great ways in Jesus' name. Thank you. Because tonight, the peace I felt was even more than the one I felt before coming. I thought I was good before coming tonight. I'm in a much better place. And I think if I feel this way, most people on this platform feels the same way. I see a lot of thank yous on the platform. I hope you guys are reading the chat box. Dr. Alu said, great discourse. Thanks. And, to the amazing speakers tonight for your deep insights. Attorney Williams said, very informative presentation. Thanks to all the presenters. Big thanks. Team of doctors, well done. Thank you very much. People, and there are thank yous all up on there. Dr. Veronica said, thanks, team of phenomenal doctors and experts. Socio-emotional integration matters. Thanks again. My dreams will be heavenly tonight. It's what, our big dude is a big guy. I love him. Ayomide Ibrahim, amazing man. Says his dreams will be heavenly tonight. Thank you so much. I cannot thank you enough. The Lord charged me to do this, and I'm like, politics. Everybody that knows me knows I'm not a politician. And I'm like, okay. And the Lord had picked both of you to come bless us. Thank you. Appreciate you. So till we meet again next week, please, I want to say